everybody. It's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. We have another guest today. Her name is Dr. Izabella Wentz. She is a pharmacist, a doctor of pharmacy. And you would say, what's she doing on this podcast? But if you don't know the name, she's been in this space for quite some time. I think we ran into each other, but we didn't really meet a long time ago. I think somebody's conference. I think JJ Virgin was there, Karazian was there. But you were, I think that was about the time you were coming out with your book, the first book. And, you're like, oh, we got a pharmacist who's kind of talking about functional medicine. This seems, a little different, but obviously you had a story about your own health and that led you to write at least the first book and probably all the other ones. But why don't we just kind of get it started with who is Izabella Wentz and what brought you into this space? How'd you go from pharmacist to now one of the leading voices in the world of thyroid physiology and functional medicine?
Well, it wasn't something I was passionate about in pharmacy school for sure. I was not interested in the thyroid. I thought it was this little boring organ, and all you had to do was give people more meds or maybe suppress their thyroid function, and really didn't have a lot of perspective into it until, of course, I had my own health challenges. When I was during pharmacy school, I struggled with brain fog and fatigue, and then I started having irritable bowel syndrome. Then when I got through with pharmacy school, I started having anxiety, the fatigue that just got worse. I started to have carpal tunnel in both arms. I started to have acid reflux, began to lose my hair, which for a Leo was just very, very challenging, right? And at that point, I was like, okay, if something is going on with my health, I was doing everything that I thought would lead to a healthy lifestyle based on what I learned in pharmacy school, right? So I was eating whole wheat bread, low-fat dairy, keeping up to date with all of my vaccines, working out, all the things that I learned in pharmacy school. I was trying to be proactive about my health, and yet my body was falling apart in my 20s, right? And so I ended up going down this rabbit hole of trying to figure out what the heck was going on with my health. Eventually, I was led to a Hashimoto's diagnosis, which part of me was relieved because I was like, okay, now I have a name for what's going on with my health. And then I was like, oh, I can just get on the thyroid meds because, this is what you do when you have a thyroid condition. But then another big part of me was like, why am I 20 and getting this condition where this is typically something that older women get diagnosed with? Is there any lifestyle changes? Is there anything that I can do to prevent the progression of this condition, to maybe not be so reliant on medications? And I started to really look under that angle of things initially while starting on thyroid meds. And then I realized that the thyroid meds actually didn't help me that much. I went from sleeping 12 hours to 11 hours at night, and that was an improvement, I guess, but I still wasn't functioning like a 27-year-old woman, right? I was functioning like really, really poorly. I was exhausted all the time and I was cold all the time. And so that's how I became a Hashimoto's expert, I guess, was through becoming a guinea pig in a way. I was starting to look at different trainings, different literature, looking at patient forums, and started to try things on myself to see if there was anything I can do to get rid of my symptoms.
So when you were initially given thyroid medication or originally got the diagnosis, you probably got the same response that most people do who get diagnosed with hypothyroidism, right? So initially, if you didn't have an elevated TSH and a low free T4, somebody would say you're just fatigued, you have depression, you have anxiety, you don't exercise enough, you're just stressed out, you have reflux, and in your world as a pharmacist, it would be like, oh, okay, we got this is the diagnosis, this is the medication that goes with the diagnosis. Did you go down that rabbit hole before you got diagnosed, or were you just having all of these different things and trying to figure it out? And then it was, hey, let me get my blood work done. And now, oh yeah, there's a thyroid condition.
Yeah, I had been trying to get a diagnosis for a while. So I went to a bunch of different doctors, one doctor for the hair loss. I had a mitral valve prolapse. I went to another doctor for that. I went to another doctor for the carpal tunnel. I had a lot of allergies. So I went to an allergist and I went to a gastroenterologist for the acid reflux and primary care doctor, all these different people. And it was like, your labs are fine. Your labs are fine.
And they were running a TSH with reflex to free T4 at that point in time, right? Because this is where a lot of people, I call it thyroid purgatory, right? When you have all the hypothyroid signs and symptoms and your labs are normal, or you get prescribed T4 medication and now I'm better, but I'm not healthy, but maybe I'm better, maybe not, but I'm kind of stuck here because then people say, hey, everything's been optimized. But you're going to people, they're looking at this and they're looking at multiple different systems being compromised, thinking these are all separate conditions, when in reality, when there's a thyroid related condition, or we have reduced conversion of T4 to T3, which was probably the beginning part for you, impacting the cellular level of physiology, multiple systems can start to become downregulated. I think we get so caught up in the TSH and the T4, but many people aren't paying attention that it's actually the T3 inside your cells that drives the metabolism. So the TSH is good. The free T4 is good. Was it the antibodies that popped and then somebody said, oh, you have Hashimoto's, but you still have normal TSH and normal free T4? Or did it all go, or was it, okay, now your TSH is positive and your free T4 is low and you have positive antibodies and that's where we're at?
So it was my primary care doctor and he tested my TSH and it was like, he actually had me repeat it because it was slightly elevated. And then it was like a 4.4 when he repeated it. And I think the cutoff range was like 4.5. So he said, your thyroid is just fine. We don't need to do anything. And then I went to an allergist and she ran a thyroid antibody panel. I had all kinds of crazy allergies to like everything. And my TPO antibodies were in the 2000 range. So she said to me, I remember this, you have thyroid antibodies. For some people, these can be an issue, and eventually this can turn to hypothyroidism. But this is essentially just a risk factor. So there's nothing that you need to do. And so then a year later, I went back to the primary care doctor, and my TSH was at an 8 at that point. And I remember he wrote me a little bit of a note and he said, your thyroid will probably burn itself out soon with your history of Hashimoto's and those elevated antibodies that you had, because I had been sharing all the results. So you probably might want to see an endocrinologist because at some point it's going to burn out and then you might need to get on thyroid meds. And then the endocrinologist is who I saw. And at that point he was like, yeah, you can probably take a little bit of thyroid meds because I had wanted to start a family. And so there's a little bit more willingness for doctors to prescribe medications for women of childbearing age, even when their TSH isn't over 10.
And that's the tricky part, right? We give the allopathic community a hard time because, hey, sometimes in functional medicine, we're like, if it's not in between 1 and 2, you need medication. I don't think that's necessarily the case, but in traditional medicine, they're saying, okay, but maybe we should wait until somebody's over 10, the 6 to 10, maybe the iffy area. My opinion is the lab value is telling a story. If that's the only lab value you're looking at, you're not seeing the fuller picture because you could have a totally normal. I have one today who's I'm just looking at her lab work and her physicians say her thyroid panel is normal because her TSH has been normal. But I said, you got to get a full panel. We got the full panel back. Her, total T4 is like 3.5, right? So total T4 is low, total T3 is low, free T3 is low, free T4 is low. But because TSH was normal, there's no thyroid condition. It's just because we didn't open the book, we didn't look at the full panel to see. So everybody can kind of get tricked when we run a little bit reduced labs. But I think we talked about this when I was on your podcast recently, we have to interpret labs, right? We have to look at as big a picture as we can and say, is that normal? is that appropriate for the person sitting in front of me? Is that normal and inappropriate for the person sitting in front of me? Is it abnormal but appropriate, abnormal and inappropriate? But it's unfortunately too often today, we don't. We run limited panels. We say it's got to be in this range before I do anything. And we're treating a lab value or a number and not really looking at the labs as the actual problem, or as the indicator of a problem and not the actual problem. So the other thing, especially coming from an allopathic perspective, you were probably told, hey, this is an immune-driven issue. There's probably not much you're going to do. Now, I would, if I would have looked at that and you had allergies and you had a thyroid antibodies at 2000, I'm like, okay, here's a woman with a Th2 driven disorder. She's going to have hypersensitivity. She's going to have allergies, maybe asthma, maybe skin issues, and she's going to produce tons of antibodies, right? But probably back then we didn't know because we didn't have all those lymphocyte panels, but that's what we would kind of think today. But do you think the challenge at that point in time was we just really didn't understand the immune system and what was going on? Or do you think it was really more like, there's nothing we're going to do anyway? And so you just at some point it's going to kick out and you're going to need medication. So we'll just give you medication for the rest of your life.
Yeah, I don't think I was well versed in functional medicine at the time, and it wasn't as popular as it is now, or even integrative medicine. I didn't have access to practitioners like that. I just didn't know that there were people out there helping with these things. It was in 2009, so it's been a few years.
Mm-hmm.
I feel like there's a lot more knowledge these days,
Mm-hmm.
but still, if you were to go into most endocrinologists' office, if you were a thyroid patient or most primary care doctor's office, you would still get that same message that there's nothing you can do about that immune system. And, to your point, I was having allergies. I was also having hives, like recurring hives, chronic urticaria.
Mm-hmm.
I don't have any of these things anymore, right? And it wasn't like they just went away on their own, and it wasn't the thyroid medications that got them to go away. Like, I got on the thyroid hormones, but all of my symptoms pretty much still remained. There was this underlying autoimmune issue that none of my healthcare practitioners were, willing to do anything about. And I went through my pharmacy school notes and I'm like, there's got to be some lifestyle things I can do. There were none. So
Mm-hmm.
that's, I started going to integrative practitioners. I went to like an acupuncturist. I went through just trying to get some information from different websites. I think Mercola website was one of the websites at that point.
Mm-hmm.
And it was like, you can try coconut oil. So I was like, eating coconut oil, slathering it on my thyroid gland. I was trying to eat some Brazil nuts and trying to do, like, what can I do to help myself? And I was starting to do a variety of different things to try to figure out what was setting off my immune system. And then I got really lucky and I got offered a ability to mentor some students. And that came with like access to PubMed articles where I could actually like log in to
Mm-hmm.
PubMed through a university and get back-end access. So all of these research articles, and I just started to dive into the research on Hashimoto's on PubMed. Patient forums were also a great resource, and try to seek out any kind of integrative practitioners that focused on immune health or focused on autoimmunity. And there's a lot more of them these days, but at the time it was still much more emerging.
So a lot of times, especially in functional medicine, we talk about the root cause. I mean, your book is root cause, right? And sometimes people get kind of stuck in this idea that I'm looking for this one thing that's caused my immune condition. I tend to think that maybe there's a thing that pushed you over the edge, but really it's about a cumulative load over time. What do you think about it? Obviously, there's the people that, they're like, I went gluten-free and it didn't work, right? Or I treated my EBV and I still have problems. So through your journey, especially back then, were you looking for the one root cause, or were you starting to learn already that, hey, this is likely accumulation of stressors on my physiology that's triggering this?
When I initially set to heal myself and started kind of writing the book and researching it, another thing I didn't mention is one of my cousins in Poland was diagnosed with the condition, and my mom said, why don't you research how to make yourself feel better? And why don't you write about it and I'll translate it for your cousin? So that kind of kicked off the idea to
Ah,
write a book. It was motivation to help myself. And then it was like maybe my cousin can benefit from it and maybe others could benefit. And so initially, like I was looking at, you can look at different case studies of somebody who had celiac disease
mm-hmm,
and they got off of gluten and then their thyroid function normalized. So I was like, ooh, could it be celiac disease? I didn't have that. And then I was like, oh, somebody else had mentioned there was a success story of somebody going dairy free.
mm-hmm,
And that was a success story. There's other stories. Somebody might have H. pylori infection and you treat that and antibodies go away, or they're using artificial sweeteners
mm-hmm,
and they take those out of their diet. And so initially I was kind of looking for that one thing. And then as I got through the research process and trying to heal myself, I realized it's like more like peeling the onion layers
mm-hmm,
versus it's just one initial like nail in your foot or something, right? And so that's been my experience. There's every now and then when I work with people, I have these like easy cases that are really easy to write up, where it'll be like, oh, this person started on selenium and myo-inositol, and lo and behold, all of their symptoms and their antibodies and their TSH normalized, right?
mm-hmm.
Um, so every now and then you get somebody like that, but for the majority of my clients, and I don't know if this has been the same case with yourself, people tend to be more complex, and it's almost like a overflowing bucket
Mm-hmm.
versus that one nail that is stuck at the bottom of your foot.
Yeah, I would say I'm rarely anybody's first stop when they get diagnosed. I mean, it's occasionally, like if somebody's already in a health and functional medicine mindset to begin with, then they're looking for somebody, right, in a functional medicine space. But most of the people that come to me, they've already been through multiple endocrinologists, they've been through multiple functional practitioners, and they're still struggling. So they oftentimes are way more complex cases. Um, I wish they were all easy, right? We can say, oh, I think it's this, but there's just there's so many layers to it. And that's why I kind of asked that question, because your first book was, root cause. And I know the roots and the roots on the cover really meant like, hey, here's all the things that can potentially contribute to it. But I think it's important because a lot of people still are saying, they're still looking for the one thing, right? I gave up gluten, that didn't work. I tried this and it didn't work. Or I'm just trying to find the right dose of medication. If I could just find the right dose, I'll be good. And I'm like, it's more complex than that. It's way more complex than that for the vast majority of people.
I think you're right. And I think Western medicine has sort of trained us that it's one pill for every ill, or it's one cause causing this. And
Mm-hmm.
I remember looking through the research where I was like, what's the one bacteria that can cause this? Or what's the one infection? And then I realized the research was more like, it's actually like you're missing this, you have too much of this, and there's this enzyme and this nutrient, that a lot of times the pathways really get impacted when a few parts are broken, for lack of a better word.
Yeah. And for me, it's one of the things and that's really important is, instead of looking, sometimes we always want to look for the external thing that's this problem or this thing I need to add, versus what I call the fitness factors, like what's going on with your sleep, what's going on with your respiration, what's going on with your relationships, what's going on with your emotional stress, your mindset, like those things, social interactions, all of those things. If they're really good, you're probably pretty healthy and you're not calling me. But if those things are bad for an extended period of time, and now you add diet and poor nutrition and antibiotics and all these things, you're probably going to be way more susceptible to every everything, bacteria, viruses, fungi, all kinds of issues and problems. So it's more about that excessive load. I usually say, our physiology is like if I had two cinder blocks in a board going across, and the stress of life is like a 5-pound weight, and we put it on there, that board could probably hold 100 pounds. And I can take a lot of stress in my life. I could put 80 pounds on there, the board's still good. I could put another 5 pounds on, the board's still good. I could take 20 pounds off and have 60 on there, put 30 more on. As long as I maintain the capacity of the board, I'm good. I can maintain good health and homeostasis. But what happens to so many of us, we just can keep accumulating weight on that board, stress on the board. And we're walking around every day, 95, 99 pounds of stress on that board. And then we have one more thing. I just got a virus, boom. And that virus, another 5-pound weight, it breaks the board. And now our immune system's overactivated. We're pro-inflammatory. I think it was the pizza I ate the other day. I think it was that. We think it was the last thing, and then we think if I just remove that last thing, that'll fix it. But at that point, the board's already broken. We actually have to go back and reduce a lot of the other stress so we can pick up these two broken pieces of wood, mend them back together, and put them back up. And when we do that, we're actually physically stronger, right? The immune system's stronger. You can actually put more stress and strain on it. But to me, I think that's the big thing we have to focus on is what's contributing to this chronic, persistent load that's just wearing me down.
I fully agree with that. I love that analogy. I feel like it's oftentimes you have to dial things in, and I talk about digging at the roots, but also cutting down the branches, right? So there might be some low-hanging fruit, like going back to the tree analogy, right? Got all of these things, like, are you sleeping well? Are you getting enough sleep? Are your vitamins optimized, right? Are your nutrients optimized? Are you eating well? How are you dealing with stress? And a lot of these things, no matter what your root cause is, supporting your stress response is always going to be helpful in helping you feel better, potentially improving your lab markers too. Whether, the cause was you got hit by a bus and had whiplash while you were driving, or an Epstein-Barr virus infection, protozoal infection, or severe toxicity, just working on your stress response, for example, is always going to help.
Yeah. So your experience, your cousin's experience leads to the first book, it's the Hashimoto's thyroiditis root cause, right? You write that book. It's how many years later now? Like some quick math. It's like 15 years later, right? Somewhere around that.
12 years since it's been published, right?
12 years later.
Yes.
So if we think about, because we're constantly learning stuff, right? And we're constantly, we can say, hey, this is what I knew. This is what I worked. This is the premise I worked under. I help people with that premise, and then we learn more stuff. But is there things you learned and wrote about in the book that now, 12 years later, working with maybe lots of people, reading lots of science and literature and research studies that have come out, is there any big takeaways that you would say, all right, I thought that then, but this is now what I think? What are the big changes you would say?
Yes,
if there's any.
So many different things. And I think a lot of the things in the book will work for a person, and it can teach them about some of the potential root causes and triggers. But one of the things I used to do is when I used to work with people, I would do a lot of functional medicine testing, and it would be thousands of dollars for them to do all these tests. And then sometimes the tests would be sitting on their shelves for 6 months before they sent them in. And sometimes they'd send the test results in, and it would take 4 to 6 weeks to get the results back. And then we'd schedule another appointment to go over the lab results. And by the time, they had started working with me, it would be such a long time that they would actually start feeling better. Sometimes the test results wouldn't really show anything relevant, right? Or they wouldn't necessarily, like, let's say they were deficient in something, a B vitamin, and I would be like, take this B vitamin. And they'd be like, oh, I don't tolerate that B vitamin. And so it would be a long, expensive process that didn't necessarily solve a lot of problems and issues. And so I had these clients with multiple chemical sensitivities, and I started putting them on liver support, just like, okay, let's just do liver support because elimination diet's not working. You don't want to do all these testing. We've already done these tests. Nothing's really come out. And the incredible thing is within 2 weeks of the liver support, a lot of them started to feel symptoms improving. Some of them would lose weight that wouldn't budge. Some of them, their brain function would come back. We do know that T4 becomes activated to T3 in the liver. So part of that awakening could have been due to that better T4 to T3 conversion. But also, I feel like a lot of us are just walking around with toxins, and doing a solid liver support protocol can just help to move some of those toxins out of our system. Part of it is like doing sauna, getting rid of, microwaving your food in plastics. We also might use targeted nutrients and supplements like N-acetylcysteine, making sure the person is pooping, using things like milk thistle, supporting the liver and gallbladder, and just getting somebody on something like that. We could still run the lab tests, but just to give them something to work on so they start feeling better right away. About 80% of people noticed results, right? I've had some people with multiple chemical sensitivities where they did this 2-week thing and they're like, I feel so much better. So that's something I didn't know about in my first book. The other thing I didn't know about was adrenals. So I kind of thought like everybody had to like quit coffee and sleep for 12 hours, do all these things, right? I didn't have children then, so it was realistic for me. And then I realized with adrenals, a lot of it has to do with like mitochondria, and it has to do with our circadian rhythm. And there are things that can really impact and cause adrenal dysfunction, any kind of toxins or stressors. And there's a faster way to recover that health. I used to recommend things like pregnenolone and DHEA, sometimes hydrocortisone, these extreme lifestyle changes. And then I found that shifting a few things around can be an incredible game changer. So putting people on like mitochondrial support, getting them really dialed into the circadian rhythm. So like spending time outside, really, really big game changer for people who have insomnia, right? And have poor energy throughout the day. And so that wasn't in my knowledge base at the time when I wrote my first book. And then the other thing I would say would be gut health. I had initially kind of thought that like I would put foods into two categories, like they're either bad or good,
Mm-hmm.
right? So I thought grains were bad for Hashimoto's, and nightshades were bad for Hashimoto's, and all these things were bad for Hashimoto's. And I didn't really have the knowledge that I have now about, okay, well, what's causing somebody to have these food sensitivities? For example, if you have a mold overgrowth in your body or a yeast overgrowth in your body, that's going to cause your body to make oxalates. And so that doesn't mean oxalates are bad, but if you eat high oxalate foods and you have this ongoing overgrowth, you're going to have some nasty symptoms. You might have joint pain, you might have urinary issues, you might have, you might feel pretty awful whenever you eat a lot of these foods. But the root isn't like to eliminate more, the advice isn't to eliminate more foods and be on a super restricted diet. It's figuring out what's really setting you off. And I could go down the road with like histamine foods and egg sensitivities and grain sensitivities. Like there's something that's causing you to react to these foods. I'm not suggesting everybody eat like McDonald's and junk food all day, but for a lot of people, they're eating a really good, clean diet, but they
Mm-hmm.
still have a lot of food sensitivities. And the approach to healing isn't necessarily to like live in a monastery and only eat 3 different foods that are blessed by, the the monks, and having like such a pure life, that there are things that can really set off our our inflammation inflammatory pathways, autoimmune. So this is a really great question. I feel like I gave you a very long answer, but these are probably the biggest top three things that I could focus on. And
Yeah, so we'll probably dive into them. We'll talk about a couple of these. And this happens for all of us because especially when we start learning stuff, right? We believe that, okay, this is it. This is what I got to do. The AIP diet, right? That was kind of one of the foundations of, at the beginning, was like, hey, somebody's got a Hashimoto's, you put them on an anti-inflammatory protocol because it's removing all these foods that could be triggering reactivity, foods they could be reacting to. It removes gluten, grains, dairy, all the possible big things. And in the beginning, I thought that was great too. And you'd see positive changes. The problem is, what I didn't know back then was if you just remove those things and they've got gut inflammation, permeability issues, and an upregulated immune system, if I remove these foods and I just increase other food proteins, more of those in a short period of time, guess what happens? They start to have a reaction to those foods. So now what do? We restrict it more, right? And so in the beginning, we just, you think, oh, I did my 30-day gut protocol or 60-day gut protocol. It should be fixed, right? Maybe the permeability is fixed. And maybe we didn't even know as much about what's really going on with permeability. But it was more like, okay, these are things, I think in the beginning, it was like, okay, let's restrict, much like you said. And that creates more problems with the biome, right? Because now we're not feeding the bacteria. We feed us. We eat so we feed us, but we eat so we feed the organisms in our GI tract, which then give us their poop is our benefit, right? So we can get benefits from some of the things that the bacteria do from our food. But I think we've learned a lot more about the gut and the gut physiology. So I think the GI tract, digestive issues, I think we're learning a lot more about food. Even the things like some of the plant-based foods, we'd say, hey, those plant-based foods are potentially problematic because they can activate the immune system. Maybe, but some of those plant-based foods actually are beneficial when we're healthy because it's like working. It's like me going down and doing a workout, a kettlebell workout. I'm working out all my muscles so that I can break them down a little bit and make them stronger. We eat plant-based foods that do have some level of toxicity to them because it challenges the gut immune system. So if we're not eating some of those things, then we further weaken the immune system. So yeah, that's good. I think that's an important thing that we're all constantly learning. I think we know like this much about really what goes on in the GI tract, and we're going to continue to learn. Even the fungal component, I think we're learning way more. I mean, for listeners, when we get a GI test, a functional GI test done, we look at the microbiome and we look at volume of organisms in the gut, and we say, oh, if there's too much volume, that's a problem, or too little of this, that's a problem. But the fungal component is only like 1% of the microbiome, and yet it can be extremely immunogenic and virulent and really become a problem. And so you could do a stool test and it looks like, oh, my candida is normal number wise, but it could be highly immunogenic. It could be the thing that's actually contributing to the chronic leaky gut that you can't fix, because you're adding these things that should fix intestinal permeability, but you still have this very virulent fungi, candida, that's actually destroying the tight junction. So yeah, I think we're learning a bunch there. The adrenal question, this is a big topic. I know you've written a book about adrenal physiology, so we may agree, we may not agree. I think there's a lot to talk about fixing the adrenals. You got to fix the adrenals first. Sometimes people put things in order. I'm not quite sure what that means for a lot of people. To me, when we think about what's going on with the adrenal system, stress, yeah, when we stress the system, initially we make more cortisol. That's a stress hormone. We can make more catecholamines and more stress hormones, right? This is right up in your wheelhouse with all the chemistry. But I think there's a point where we start to see compromise to some degree in adrenal physiology. And I think that's part of, and we talked about this a little bit on your podcast, when we have that cell stress response, from my perspective, there's a downregulation, adaptive downregulation of T4 to T3 as a protective response. And one of the things that's really important is and if you know different, please correct me. But the adrenal gland has the ability to generate cholesterol to make into hormones like cortisol, DHEA, right? These are precursors to our sex hormones. But it's a limited capacity to some degree. Where we get a lot of volume of that is bringing cholesterol out of the bloodstream. And from my research review, you have LDL and HDL that dock to the adrenal tissue, and those receptors are highly depend on the amount of T3 in that adrenal gland to actually pull that cholesterol into the tissue. And the mitochondria really rely on T3 to help support the function, so to convert that cholesterol into pregnenolone. And now we're on to our production. So I think what happens with a lot of people, and again, like if you see a different side of this, please kind of put it in there, because I know that I'm not right on everything. And so I like some counter discussion. But I think we talk about, hey, we got to address the adrenals. And I think to me, and maybe to you, it's like, okay, what are the life stressors that are putting more stress and tension on the system that we can reduce? And many times that'll help. There are some things, herbs and things that can be more calming on the system. But a lot of people want to jump to support, like they need to give something sometimes to the adrenals to fix it. Or we look at somebody and go, oh, they have adrenal fatigue. I don't think the adrenal gland ever fatigues. I think it's just the chronic stress response. And initially it's good. And then we start to downregulate that cortisol production. Catecholamines may still be upregulated chronically. But do you see, from your perspective, that the big issue is we need to give something to kind of force the adrenal gland to work? Or is it we really need to take a look at how do we just calm the load on the system so the adrenal gland isn't constantly taxed to make cortisol and or catecholamines when cortisol really starts to struggle a little bit?
Yeah, I think you're explaining it really, really well. I know the old school practitioners used to believe that the adrenals were like physically tired and they were not able to make more cortisol. And this can happen with Addison's disease when they're damaged and they're not able to produce cortisol in the right amounts. And so I know that there was like kind of an old way of thinking about it. And that was before my time. So the training that I had was more about HPA axis dysfunction, where essentially it's a communication breakdown between the brain and the adrenal glands, and that they were capable of producing cortisol, but they weren't for whatever reason. And it could be nutrient deficiencies. It could be because you were under a period of a lot of stress going on in your life. And stress could be defined as current emotional stress. It could be defined as past traumatic stress. It could be defined as blood sugar imbalances. It could be defined as watching way too much fear porn, TV, things that set you off into a place where you're just scared of your neighbor, you're scared of everything going on in the world. And so there's different pathways where stress can occur, and that can really leave us in that survival mode where our cortisol production is going to slow down throughout the day. And looking at testing of people with Hashimoto's, a lot of the people that I would see would tend to have lower cortisol output throughout the day, not because they had Addison's, but because there was this communication breakdown. And so rather than putting somebody on like adrenal glandulars, the more relevant thing to do would be to help them reset those pathways. And sometimes it sounds so basic, but sometimes just getting them to do pleasurable activities, getting them to do things they enjoy, spending time in nature, getting plenty of sunlight. A lot of these things can go a really, really long way. Like actually getting sleep can really help to connect that pathway again. I'm not saying this is going to be for everybody and that nobody should ever take adrenal glandulars. But I will say for a lot of the ladies that I've worked with, this is like a very quick turnaround where we'll support them, and within weeks they're going from like bedridden to running up and down their stairs and organizing their homes and just feeling a significant um, transformation. And so, you mentioned about cholesterol, right? So a lot of times people who have thyroid issues, hypothyroidism, they will also have high cholesterol. And cholesterol is such an important precursor. And it's
Mhm.
like one of the reasons it could be elevated is because the body needs more hormones to, um, there is you know, the proper conversion from cholesterol happens. We require a few different things. So healthy function of the mitochondria, they act as gatekeepers from pregnenolone production. We do require enough of having T3 happening. So sometimes supporting the gut or supporting the liver, figuring out if like some kind of deficiency is driving that low T3, having sunlight, vitamin A in the retinol form, magnesium. These are all like cofactors that we need for that proper conversion. So I don't necessarily say like you need to be on glandulars, but perhaps doing Epsom salt baths. This can be a great way to get magnesium into your system, making sure that you're eating for blood sugar balance, getting some high quality proteins and animal-based foods that contain retinol. So this is the active vitamin A form that's going to be
Mhm.
helpful for that conversion. And I do love to use adaptogens for a lot of
Mhm.
people because they can really support their healing in adrenals. So that's still something that I used to use and I still use. I don't necessarily say you need to get off of coffee or caffeine, but if they're drinking 8 cups of coffee a day, then we'll want to work on getting that lowered. And then I also focus a lot on like mitochondrial support. So carnitine and D-ribose, vitamin C, magnesium. A lot of these are mitochondrial cofactors. And that, interestingly, has been a really helpful tool for some of my ladies with brain fog and fatigue and just feeling overwhelmed. When they support their mitochondria, they start feeling significantly better. With carnitine, I do see a lot of improvement in like brain fog within 3 to 7 days. So that's been I guess the evolution of my protocols with regard to adrenal health. And I don't know if that's in agreement with what you were saying and how you approach that. And of course, there's a lot of different triggers that can cause people to have quote unquote like chronic fatigue and low cortisol output. Um, what I would do with people is I would give them like a solid support plan
Mhm.
that they could do on their own. And then we would figure out like what's going on. Is there like a toxic exposure? Obviously, not many people can work on trauma by themselves, but they can work with somebody on that. And, what are the deeper layers of things we need to address?
Yeah, listen, foundationally, I don't think we would disagree on much from hey, the person's got adrenal issues. I talk about this in my book, and I think anytime we've had excessive stress on the physiology, we're in a pro-inflammatory mechanism. We're going to have adaptive changes. I expect every system to become dysfunctional in time the longer it goes on. So we have a name I call it a multi-system adaptive disorder. That's what they have. Because do I have an adrenal problem? Do I have a gut issue? No, look, everything's going to be downregulated because of the stress response. It's a multi-system adaptive disorder. You're not broken. This is your body adapting. You have a limited amount of energy, and your body is using the resources appropriately. So you're not broken, but you should expect your sex hormones are going to be dysregulated. Your adrenal is going to be dysregulated. Thyroid's going to be dysregulated a bit. Blood sugars, everything's dysregulated a bit. So we just got to reduce what's contributing to the excessive stress load. Let's reduce it. So all those lifestyle factors, they're foundational, right? You have to work on those things. Sometimes somebody's lucky enough that the micronutrients help. And I think sometimes from a micronutrient standpoint, it really depends on the state of the individual. And that's why I think the lifestyle factors have priority, because if we just add more nutrients into a system that's already in a cell stress mechanism, stiffened cell membranes, reduced transport, reduced absorption. Those micronutrients may not get into the cells and support the mitochondria the way that we want them to, or we can give them something with good intention and they go, that makes me feel worse. And we look at our pathway and go, no, that should make you feel better. Nope, it makes me feel worse. Because the cells actually, at the end of the day, the cells in the body actually determine which direction something goes. Hey, if you're in homeostasis and we give you some foods that are higher in tryptophan, you're probably going to make more serotonin. You're going to feel good. You're going to make more melatonin. You're going to feel good. But if you're in a excessive stress situation and your body's and your physiology is upregulated, you may push that tryptophan down a chynurenic pathway, make more neurotoxins that excite your brain, which is great for defense, but not great for rest and recovery. And so unfortunately, we don't always get to choose which way we go. But I think, at the end of the day, the adrenal system is a window to, we just got to calm the whole cascade down. And adaptogens can be very helpful. And there's lots of different ones that can be helpful. But I think ultimately, we're still thinking about the same thing. How do I reduce this person's overall stress load? Life and lifestyle factors often come first. And then many times we can then say, okay, you're doing all those things right. There must be, now we may have something, bacteria, virus, fungus, or something that we really have to focus on. But if we just do those, if we just look for those and we don't address all the life and lifestyle factors that create this toxic, the environment that makes those things thrive, no wonder I've got chronic Epstein-Barr virus. I can't get rid of it, right? Because the environment's good for it. So you knock it down, it comes right back.
Yeah, definitely. Like, it's interesting because people will say, okay, but I've got Epstein-Barr virus, but yet they're not necessarily trying to work on their stress response, or they're not trying to work on their gut health. Things like vitamin C, just getting on some vitamin C can be helpful for supporting the immune system to overcome that particular infection. Or they'll be like, oh, well, I have mold toxicity. And then I kind of go through, okay, well, mold is going to impact your mitochondria. So taking some mitochondrial support is going to help with that. Supporting your liver pathways is also going to help you get rid of mold. Doing some sauna can help you get rid of the mold toxicity in your body. You definitely want to work on your home environment. You might want to utilize some protocols to clear the mold from your gut or sinuses or wherever it might have taken up residence. But a lot of times people might not do those foundational things. And if they just go for like, let's do the antifungals, let's just get on that, they still might not heal, or they'll just say like, oh, I just moved out of my moldy home. They can actually take the mold infection with them, and it can colonize them versus like leaving and treating it correctly. That's like usually the pathway where you have to work on a few different things. And for me, like liver support, adrenal support, and gut support tend to be very foundational, because I feel like those, like you said, a lot of times those systems are going to be impacted when a person has an autoimmune condition, when they have hormonal imbalances, when they've got chronic fatigue, is you're automatically going to have to work on supporting their detox pathways, adrenal pathways, and gut pathways, in my experience. And there's always more than one way to peel a potato, but I feel like people are oftentimes surprised to hear that they might think like, oh, I only have a gut issue, or I only have this toxic issue. But a lot of times it's like the toxins are going to impact your adrenals and your stress response. And when you're stressed out, guess what that's going to do to your protective gut bacteria? Your bacteria are going to shift, and the secretory IgA that protects you from pathogens, that's going to get depleted. And so a lot of times you have to work on that component. And it's, I think it can be a little bit intimidating for people that are used to just having the one pill for every ill, where they realize it's like oftentimes you need to do few different things to get better. And I think you have identified 18, is that right?
When I talk about the fitness factors, yeah, those are all different aspects, lifestyle factors that I work with my clients to try and let's talk about your relationships. Like, let's assess those. Let's look at your sleep. Let's look at your mindset. Let's look at what are you doing to actually stimulate your brain, right? To become more intellectually healthy, right? So all of those things become really important. So let's dive into this because you're a pharmacist, okay?
Mhm.
And so a big discussion is about medication, the right medication. What's the right thing? Do I need T4? Do I need tyrosine? Is levothyroxine? Should I take Synthroid? Like, should I not take any of those because they're all synthetic or that they're not natural? And we can argue that point, whether they're natural or not natural. But some people say we need glandulars, or we need a compound, like we need T4 and T3. There's other people that say T3. Now, every person potentially needs something different. And to me, it all depends on what are they trying to do. Are you trying to manage a lab value, or are you trying to recover your physiology? But let's start with T4 medications. Is there a huge difference between the different T4 medications from a pharmacy standpoint that causes concern in your mind about the T4 medications at all?
So T4 medications like Synthroid, levothyroxine, Lavoxyl are some of the most popular brands. There's also Tyrosint.
Mm-hmm.
And I would say for a lot of people, they do work pretty well. They get their numbers optimized. They help them with their symptoms. I don't tend to see a lot of those people personally. I feel like for the people that those medications work for, they're not seeking out information from individuals like myself or from you, right?
Exactly.
I'm not going to deny, like, they work for some people, they work really well. There is a subset of people that might do poorly with these medications. Some of the reasons could be because they're not absorbing the medications correctly.
Mm-hmm.
Thyroid hormones are notorious for like drug interactions and food interactions and drink interactions. So if you're a coffee lover, and if you have your thyroid meds too close to your coffee, then you can be sabotaging your absorption. At that point, you might want to consider something like Tyrosint, which is a gel cap, right? And the gel cap bypasses all of the different interactions that you might have with foods and drinks. And it was an interesting study because it was done in Italy, and Italians love their espressos. And these patients were having a really hard time managing their thyroid numbers. I don't know if they even talked about symptoms in this study, but that's kind of what modern medicine does is
Mm-hmm.
like looks at the labs. But they were finding that patients were having a hard time getting to optimal levels with having coffee with their meds, even if they were spacing them out. The general recommendation might be like an hour. But some patients, even having coffee 4 hours later, would have an issue with maintaining their lab values. And so the gel cap, it was also invented in Italy. And so these Italian doctors and researchers found a way that you can have your thyroid meds and your espresso too, because you can drink your coffee with your meds and it doesn't impact absorption. There's also people who might have gastritis or other kind of issues where they don't properly absorb medications from their digestive tract, and that can really impact their ability to absorb most thyroid meds, where the Tyrosint, the gel cap, would be an exception to that. So this might be one reason why a person might not be doing as well on these meds. Another reason might be conversion from T4 to T3. And on paper, if you take a T4 containing medication, it's going to convert into T3, the more active thyroid hormone, in the amounts that your body requires and needs. So this is what I learned in pharmacy school. If this was in the textbook, right? You take this, it converts into that. And this is
Mm-hmm.
known as a prodrug. But the tricky thing is that not everybody does that within their bodies. So just because a chemical reaction happens on paper every time doesn't mean it's going to happen in the human body. And there's a variety of reasons for that. It could be genetic variations. It could be because you are low in iron. It could be because you are under a lot of stress, because you've been fasting, because you're low in zinc. And there's like a whole host of different reasons why you might not make that conversion. Oftentimes it does happen in what's called the peripheral tissues. So it doesn't happen necessarily in the thyroid. It might happen in the liver or in the gut. And so there are people who might do very poorly with these medications because they're not activating them to the more active thyroid hormone, which is known as T3. And they might say, I'm taking Synthroid or levothyroxine, but I still have hair loss, brain fog, cold intolerance, fatigue, symptoms that should respond to optimal levels of thyroid hormone for many people. And of course, there's other reasons why people might have those symptoms. So that's kind of the take on that. And then there's natural desiccated thyroid hormones. Should we get into those or T3?
Yeah, let's I want to add a little piece to that. So I think you're right. There's a lot of factors where people just may not do as well on T4 only. Immune, inflammatory issues. We have to keep in mind that anybody who's got hypothyroidism, for the 90% of the people, that you already have an immune inflammatory process going on. That's what's creating the damage to your thyroid gland. And we do know, based on the literature and the science, that the immune inflammatory process, when there's inflammatory processes going on, there's a reduced conversion of T4 to T3 in some tissues. Some tissues it's upregulated, some tissues downregulated. So we can have a net decrease of T4 to T3 conversion. Old school, we used to think like all of the liver was doing like 60% of the T4 to T3 conversion. We now know that based on Dr. Bianco's work and others that, maybe not so much. Maybe 5 micrograms there, 5 micrograms in the kidneys. Maybe the other 20 comes from the peripheral tissues together. So the deiodinase 2 conversion, not the deiodinase 1 from the liver conversion, actually does most of the production. But there's a lot of things. If you already have an immune inflammatory condition, and you just take T4 medication, you might still be symptomatic because the T3, total T3 and free T3 are low, and you're just not converting it well. And you might see, if your doctor runs it, you may see an elevated reverse T3 in that situation, not because you're broken, but because the body is saying, we don't want all of that T3. We're trying to slow the metabolism down. This is from my perspective. And you may agree, maybe not agree. But in those situations, that's where sometimes T3 medication, it's definitely where we started kind of shifting gears and saying, okay, maybe we need to give some T3 medication. And that, we'll talk about that, but that can become a slippery slope. But generally, people think because the glandulars they're desiccated thyroid from an animal, that's natural, that's going to be better. It's not necessarily better. And I think I see some challenges with it, but are there, from a pharmacological perspective, what's different about the glandular products than just the T4 or just the T3 that you might say, hey, that's a benefit or maybe not a benefit?
So there's a lot of changes happening with the natural glandular products these days, and part of the complaints or issues are the purity of them, right? And so back in the day, they were measuring the iodine content in a thyroid gland of an animal to determine the correct dosage, but that could depend on the animal's iodine status. So the dosing was a little bit tricky to get, right? So T4, natural desiccated thyroid extracts typically contain a bunch of stuff, but T4 and T3 are the two things that are thought to be the most physiologically active. And back in the day, it was kind of hard to control those ratios. So you might have a batch of medications one month and you would be perfectly controlled. The next month, you would be overdosed. The following month, you might be underdosed. These things have improved. So to the point where now they can test how much active hormone T4 and T3 is within the products. And I do see a lot of people who maybe struggled with T4 containing medications. They do report that they feel better. They do find their brain function tends to work better. They do find that their symptoms improve. And so I think that's wonderful and important. There is some school of thought that there might be some T1 or T2 And does that have physiologic activity? There's some controversy about that. There might be some thyroglobulin in the mix, and potentially that can be antigenic. So for some people, and I wouldn't say it's for everybody, but it's always good to test your thyroid antibodies before and after. They might see an increase in symptoms, thyroid antibodies. They might not do well with the thyroglobulin content. I will say that's kind of a minority. I do see a lot of people doing well with it. With regard to T3 and what you said with, okay, like it's like, why are we trying to downregulate that production? Sometimes I feel like that can be a slippery slope where there are people that are like trying to bypass the system
Mhm.
where they're like, okay, let's just get everybody on natural desiccated thyroid, or let's just get them on T3, and they might mega dose these individuals. I've had people who have come to see me who were mega dosed on T3 only therapy or mix of T4 and T3 and NDT. And essentially they were having fatigue, but like nobody looked at their cortisol levels, or nobody looked at their ferritin and iron status to see if that was a potential issue. Nobody thought about like, do they have a gut infection or are they mold exposed? Where, you're kind of trying to bypass that system with more meds. I don't, yeah, I don't agree with that. I feel like you need to, yes, you can do the meds, but like, let's not keep pushing the doses up, and let's not keep trying to be like, oh, the reverse T3 is high. You just need to add more T3. It's like, there's a reason, like that marker is a message from your body. Like there's something that's messing with that. Are you over exercising? Are you overeating, undereating? What are you like, what's causing your body to think that you're being chased by a bear, right?
Yeah.
And that's my kind of approach. I love medications, and I feel like we should pull from every I feel like there's a lot of different things we need to do to get a person in balance, where the challenges I see is like some practitioners will be like, "Oh, let's just give you like super high doses of medications," right?
Yeah, if some's good, a lot's better. Or we'll just keep doing it. But I get beat up sometimes from people because they think I'm anti T3. I'm not anti T3. I am, if somebody's focused on, if you're taking a full thyroid gland replacement, let's say, hey, my gland's shot, I'm taking 120, 130, 150 micrograms of T4. You've essentially turned off TSH. TSH is turned down. Thyroid gland's not doing any work. The thyroid gland normally makes 5-10 micrograms of T3 per day. We should probably give that person maybe a little less T4 and give them 5 or 10 micrograms of T3 to kind of match what a healthy thyroid gland would make. But if there's still reduced levels of T3, then we have to start asking that question. Like, okay, we gave them a little bit of a Band-Aid. We kind of helped out. But now we've got to ask the question, why is the conversion reduced? Is this because a person actually does have a polymorphism? And if they did actually have a polymorphism, then why do we need to give them the T3 anyway? Or maybe we need to give them more, right? But they got through the first couple decades of their life with a polymorphism and probably a lower level of T3. So that's part one. Part two, it could be simple micronutrient deficiencies that are in the system, and maybe, and in that situation, I'd be like, okay, but what's going on with the gut and diet and lifestyle and factors first, right? Because like, if we just add a whole bunch of supplementation to a bad gut, are we really going to get the response we want? Maybe not. But then the other part is, okay, is this the adaptive response? Is this slowing down of conversion the adaptive response? And to me, I think that's what is typically going on in the vast majority. So if somebody said, hey, 5 micrograms twice per day makes me feel good, maybe 10 micrograms twice per day really makes me feel like stable and sane. Okay, but are we trying to recover your thyroid gland? Yes. Okay, then I don't want you having a TSH at 1.2, 1 to 2 or below 1, because your thyroid gland's never going to get a chance to recover if you're constantly doing it. So if we're trying to help you recover, we want to have you take in kind of keep that TSH a little bit higher, not being overly suppressive with medication, and see how you convert T4 to T3. Because as we start to work on reducing life stressors, infections, dysbiosis, that T4 to T3 conversion comes back online naturally, at least in my 30 years of doing this. And we can see it improve. But I think we run into challenges with people sometimes because they get that little bit and they get that, it's like it's like a drug, like it is a drug, but I mean, it's like they get that hit and they're like, oh, is that what better feels like? And then it doesn't last. And they're like, all right, give me more. So it's like we start to get some of these people like almost like addicts. And I think sometimes too, the issue with that Armor and NP thyroid at low dose, I don't really have a huge issue with it. But as we start to ratchet it up, the ratio of T4 to T3 in there is different than typically a thyroid gland would make it. And then do we overly suppress pituitary TSH, again, suppressing the ability for the physiology to recover? And do we start overloading T3 compared to T4? A lot of things to possibly kind of go in that can go into that. But lower dose, small dose T4, T3, I don't see it as a bigger issue. It's when we start to ratchet those levels up that I'm like, what are you trying to accomplish here? I'm trying to find the optimal range. Well, if you've seen 6 practitioners and you've tried T4, T3, compounded, Armor, NP thyroid, and you still haven't found it, and you've seen a lot of physicians, it ain't the med. You got a stress response that has to be addressed, and that becomes the big issue. And in that situation, let's see what the gland can make. Let's kind of make sure there's enough T4 in the system, a little bit of T3 if it's needed, but we don't want enough T3 that's going to further suppress TSH, because then I got to give more T4, or I have to really ratchet it up. Another thing I wanted to ask you about, because it's sexy right now, is there's a lot of T2 supplementation out on the market. Like, this is the solution. Well, if the body doesn't convert T4 to T3, T3 can metabolize the T2, and T2 has benefit. I've got my take on it, but let me hear what your take is on T2.
I don't have a ton of experience with it, to be honest with you. I did interview Amy Horniman, who has a T2 supplement on my podcast. So people can definitely listen to that. It's something that I'm still learning about. I know it's been a thing in the bodybuilder community, not something personally that I've experimented with or recommended for clients at this point, but super, super interesting.
Yeah, I think T2 is more of the backup battery. I think when we have there's multiple forms of T2, but there is a form that can support the mitochondria. But I look at it more like a backup system. When we have cell stress and there's reduced conversion of T4 to T3, and then you're starting to metabolize the hormones, deactivate them a little bit. If we're metabolizing the T2, at least one of those forms of T2 can kind of act like the backup battery. But to me, that doesn't mean because the body doesn't convert T4 to T3, let's just give T2. I think we're going back to a very allopathic approach to it, which is, well, if the body's not doing it, then let's try this other method. And I think it can make people feel a little bit better, maybe sometimes. But again, what are we really trying to accomplish? Because I can give somebody a glass of wine and make them feel better, at least temporarily, right? There's a whole bunch of people walking around in Kensington that started with a little bit of crack and felt better and now are zombies. So do we want to overly ramp up the physiology? And from my perspective, and I know you like to do research, but there's a lot of studies out there that are coming out now. When I wrote the book, I stumbled across my thought process of what happens if we give too much thyroid hormone to somebody. Could this be problematic? And I found a paper, Kelly Halderman, a friend of mine who kind of co-wrote the book with me. I'm like, Kelly, if there's abnormal cells, thyroid hormone is going to bind to integrin receptors and it'll cause those abnormal cells to replicate. So how do we know that this hypothyroid issue isn't a protective response? And this was in my early days of Navio's work and stuff, but I'm putting that stuff together. And I'm like, nobody will ever do a study that looks at the correlation between those on thyroid hormone and those not on thyroid hormone and cancer, right? When we think about these integrin receptors. And 2019, a paper came out, and the incidence of almost all types of cancer was increased in those on thyroid medication. over a period of time. So it was like, whoa, how about this? And now you're starting to see more papers starting to talk about this connection, like, hey, hypothyroidism is more of this, it can really be a protective response. So I think we probably have to be a lot more cautious today in saying, should we just give people thyroid medication just to make them feel better or manage a number, versus really do what we should be doing in functional medicine, which is what's really driving this process. I don't know if you've seen any of that literature.
Yeah. Something, the first one that I saw was in 2013, and it was increased rates of lung cancer with the use of levothyroxine in women. And then there are, I know people have asked me to speak on longevity summits and so on and so forth. And I'm like, well, I'm not actually sure how thyroid hormone replacement impacts longevity, because there are some people with a higher TSH that are shown to live longer, and that does tend to increase with time. I'm also noodling on, should we be on T3 all the time, right? That T3 kind of gives us a manufactured amount of energy, perhaps when we should be resting, right? That we go through life's natural rhythms and our body kind of manages that for us, right? And so if we are doing it is a natural desiccated thyroid or synthetic thyroid or whatever, we're giving ourselves better living through chemistry, right? So maybe this manages our mood, maybe this manages our energy levels in a time where we should be in a bad mood and we should be upset and we should be tired, right?
Right.
And so I oftentimes think about a lot of these nuances, and then of course the research with increased cases of cancers. It's like, is the thyroid hormone causing the higher rates of thyroid cancer, or is it like a person is coming through with inflammation and autoimmunity, and we're trying to kind of kill the messenger by giving somebody thyroid hormone? And so I think that these are all the things that I that I think about at night when I wake up at like 2 a.m. and I'm like, I wonder about that, and like looking at the latest research. So it is something that, again, like you said, you have to consider the person's goals and what they want. Like, are you trying to just like get out of bed in the morning, and do you feel so terrible that you need to have something right now? And in that case, you can have thyroid hormone and that can help you, right? And there's these other lifestyle changes that can help you. Or are you somebody that's feeling overall pretty well and your goal is to not be on thyroid meds and live a long and healthy life? And so these are going to be two different people. And I've had clients that their goal is to not take any medications, and that's their absolute number one goal. And then I have other people that are like, I want to get pregnant. And then there are other people that are like, I feel like complete crap. Like, I just want to feel better. And so I oftentimes think about, like, what are your goals as an individual? How do we get you to that place? Like, I have my biases and I think, what everybody should do, but that's not necessarily the right path for everybody, right?
Oh yeah, we all have our own bias, right? Every one of us, right? We all look through things through our own level of bias and ignorance, right? So, but at the end of the day, it doesn't matter it's not as much about what I think, it's about what is the actual, what are you trying to accomplish? Sometimes that's a part of our job, is like, what do you want to accomplish? I don't want to take thyroid medication. Okay, then you're going to have to change something about diet, lifestyle, behavior, habits. Oh, I don't really want to do that. Okay. Well, then you can manage your signs and symptoms and manage your lab values with T4. And if that doesn't work, add some T3, whatever form works best. But ultimately, you're just managing a condition. The other one is, hey, I don't want to take thyroid medication, or I just want to feel better on my thyroid medication with as little as possible. Oh, okay. Well, then we got to make some changes to diet and lifestyle so that that medication actually gets absorbed better, it actually works better, and maybe that your thyroid gland can start to recover. Okay, well, what do I need to do? We got to change these things, these lifestyle factors, these habits, these behaviors, these things you do every day. Oh, I can do that. Oh, perfect. Then you need a different model. So depending on what the individual wants, really determines what kind of how we treat them, our treatment strategy. Some people just want a management model, and that's fine. I've got high blood pressure. Okay, well, you got to start exercising and eating better and drinking less. not doing that. Okay, then you need a blood pressure medication. Maybe you'll need 3 by the time, in the next 10 years. But it's a different strategy. But that person might say, oh, I can lower my blood pressure by just eating well and exercising and not drinking as much alcohol and quitting cigarettes. Yeah, I can do that. Right. So it's a different model. But to me, the allopathic model is really good at the management model. I mean, as a pharmacist, you got a whole cabinet of stuff that you can manage almost every sign, symptom, or disorder. So that let medicine be the wheelhouse that manages all that stuff. That's what their strong suit is. But to me, my goal for most of the people that come to see me is, this is what I do. Does that match with really what you want? No, I really want just the medication. I don't prescribe medication, so I'll give you my recommendations, but go see somebody else and they'll try and manage it. And if it doesn't work out, come back and see me. There's not a right or a wrong, in my opinion. It's really about what the individual client wants.
Mhm. Yeah, I fully agree with you. And I love that you focus on deprescribing thyroid hormones and allowing that thyroid function to come back, because I feel like a lot of people are just happy with, we're just going to give you thyroid meds and there's nothing else we can really do, where there are a lot of different things. And I think you have a ton of these different strategies and a lot of experience in helping people recover thyroid gland function, where a lot of the even integrative and functional medicine practitioners, it's kind of like, okay, everybody gets a thyroid med and we do escalation of dosing, where in my experience, there are a few things that people can try, whether that's selenium myoinositol, just a lot of solid lifestyle changes, figuring out some of those triggers, figuring out if you can do like red light therapy over your thyroid. So there's different things. I tend to be more comfortable with people who are more in the subclinical stage in trying to be a little bit more, I guess, like what am I trying to say here? Like people that are in the subclinical stage, I'm usually like, and they're very passionate about not being on thyroid meds. I tend to be very supportive of that because there's a lot that we can do
Mm-hmm.
to help them get optimized. When a person is like really, really struggling with symptoms and they're really struggling with potentially really elevated TSH and low levels of T4 and T3, I tend to be more of an advocate for like, okay, let's get you on medications and let's work on all of these other things, because I feel like if you're not on medications, that can further increase the inflammation and just lead to like unnecessary suffering. But of course, it's always up to the person. I feel like people need to be their own advocates and make those decisions by themselves. But if I had like a breakdown of where I'm really comfortable with a lot of lifestyle changes and things, it's going to be in that subclinical state. And a lot of the postpartum thyroiditis cases, or like the people that haven't done a lot yet,
Mm-hmm.
like that's like, okay, we can try these things. But then there's the people that have been feeling really unwell for a really long time. And then I'm like, okay, maybe the kindest and most helpful thing is to do all of the repair work and also get on some hormone too.
Yeah, I think it's an all or none, right? Like if you see like uh, one of my clients today, looking at her lab work and you're like, I know your TSH is normal, your doctor says you're good, but your total T4 is low. You need to be on medication. I don't care what they say about your TSH. Show them the rest of this panel and they'll see that the total T4 is low. So you need to be on medication. Like there's no, like right now we need to get you to a level of stability. So we can do all these other things, but right now you need some thyroid medication. That's what you need right now, today. Same thing sometimes with the hormone stuff. Even if a woman's coming in with an estrogen less than measurable, maybe we should get you a little bit of estrogen to help your mitochondria, but maybe we don't need to have you at 100 for a 75-year-old woman, right? We just need to, but some might be beneficial and helpful. So I'm not anti, I'm just like minimal amount to support basic. And then if we're trying to recover your physiology, then let's not overload the system, because that too can create an issue, right? You start, even with the HRT, you start loading up on HRT. Now you start increasing binding globulins. Now we have less free cortisol. We have less free thyroid hormone. And now we can have other issues just because we ratcheted up one system in an effort to optimize, right? We're in this biohacking world. I want to finish this up by doing a couple things. One, I know you're always putting stuff out. You're always got stuff out. So what's Izabella Wentz doing today that people should know about?
So I have a book coming out actually on irritable bowel syndrome. So it is a lot of the different root causes of irritable bowel syndrome. It also goes into how to reverse food sensitivities. And like we had talked about, a bit of an evolution of my work. A lot of people with Hashimoto's have had issues with their gut. And I
Mhm.
had to really learn how to manage that with, without just like an elimination diet, because that was
Mhm.
initially like, oh, AIP, just get off of more foods. And so I have a book coming out. It's called IBS, The Root Cause, and it's going to be out in March of 2026. It was a long time, very, very long process of writing it. So I'm excited to get that out into the world. Hopefully, it'll help more people with Hashimoto's and perhaps autoimmunity and prevent some cases of autoimmune disease. I don't think we touched on this, but I know you're well aware of this as well, is that if you just take thyroid meds, and I'm okay with people if they just take thyroid meds when they have Hashimoto's, like that's absolutely their choice. But they should also know that, like, not working on the pathways that you talk about and I talk about, that can lead to progression of autoimmunity, right? So you might come up with another type of autoimmune condition. And some schools of thought might say even cancer, right? That this autoimmunity can be progressive. And so we do need to do a lot of the different lifestyle changes that, you and I are both passionate about.
Mhm.
This book is particularly focused in on like the gut lifestyle changes. So even if you don't have like symptoms of IBS per se, a lot of the strategies in there are going to be relevant for people with autoimmune thyroid disease because many of them do need to work on their gut health.
Yeah. For the listeners, it all we generally say in the business, like 70% of the immune system surrounds the GI tract because that's your GI tract is out technically outside the body, right? It's just a tube that goes from your mouth to your anus. You dump stuff down it, and then we extract what we want out of it and throw stuff in there. And it's like a septic system that we're just throwing it through this piping. It's more technical than that. There's a lot more stuff, but that stuff is meant to stay in there. The bacteria is meant to stay in there. The fungus is meant to stay in there. There's a gap between essentially the hole that everything's traveling down and the intestinal cells. It's like the demilitarized zone, right? Between North and South Korea. Like that's where the immune system is hanging out. Like, hey, don't come in here. Don't come in here. But between diet and lifestyle and all those things going on, that mucosal membrane gets broken down. The immune system can either get upregulated or downregulated, increase Th17, decrease Th17. Either one of those things can make somebody's mucosal membranes very vulnerable to problems. And then that can be the beginning trigger. And as Izabella said, taking thyroid medication doesn't change thyroiditis. It doesn't change Hashimoto's. Antibodies, no antibodies, doesn't change it. So we just give medication. If your immune system is still dysregulated, the likelihood is there's going to still be more immune and inflammatory processes going on, more glucose resistance, more adrenal dysregulation, more sex hormone regulation, and yes, more likelihood of immune and autoimmune conditions, because if there's more organisms and their toxins leaking out of that GI tract, you're upregulating what we call the immune cells with parts of those things called PAMPs, parts of the damaged tissue called DAMPs. And I think you and I talked about this, but the thyroid gland just so happens to have what we call pattern recognition receptors or toll-like receptors. And as soon as those DAMPs and PAMPs start binding to your thyroid gland, the thyroid gland becomes an immune-like cell and starts releasing inflammatory mechanisms, cytokines and chemokines that start attracting all the lymphocytes in. And now you have thyroiditis. And we could argue about whether that's an adaptive response or broken physiology, but at the end of the day, it's not just the thyroid gland in most cases is the response, not the cause. And so looking at the gut becomes really important for the vast majority of people because it's the easiest entry of things into the body that shouldn't really get into the body. So that's awesome. So in March, that's coming out. You have a new podcast, correct?
Yes, and I just had a wonderful guest that joined the podcast, Dr. Eric Balcavage. So it's called Thyroid Pharmacist Healing Conversations Podcast, and I'm super excited to share our episode.
Fantastic. And I guess if we were going to finish up with just a few like words of wisdom or two or three strategies, if you had to give anybody like some three strategies, three things that they would do to maybe start improving their health, regardless of what their diagnosis or condition is, what would those three strategies be?
I will say for most people, spending time in nature and getting adjusted to the circadian rhythm, so spending time with natural light is going to be a really, really big game changer. If they can also try to limit their exposure to blue light, especially after dark, that can be really, really helpful. You can buy blue light blocking glasses, you can use candlelight, you can turn the lights off in your house or use red lights in your home. But that getting into that circadian rhythm balance can be a really big game changer
Mm-hmm.
for rheumatoid arthritis, for pain, for insomnia, fatigue, almost every kind of autoimmune condition. In my experience, there are some studies in shift workers, for example, that they have higher rates of Hashimoto's antibodies and autoimmunity. So just really getting properly aligned
Mm-hmm.
with our circadian rhythm can be a really big game changer. Um, One of my favorite supplements for thyroid fatigue is benfotiamine. In some cases, I have had people who were bedridden and just feeling awful for decades and many years. And starting on about 600 milligrams a day of that has helped them recover their energy like 3 to 5 days. And of course, you want to work on whatever else is going on in their bodies, but sometimes just having more energy gives you the ability to like cook food for yourself and to work on your health and your relationships when you're bedridden. There's not much you can do, right?
Mm-hmm.
But even clean up your environment. So I think that's been something a lot of my clients have benefited from, and it's very inexpensive, very easy to utilize. Let's see what else I would say. Wow, another thing would be to get a dog because dogs can help us with getting our activity levels up. They can provide unconditional love. They can really boost our oxytocin and definitely reduce the incidence of allergies in children and offspring and just really help to improve a person's mood. I don't currently I don't currently have a four-legged creature in my life, but I will say that I'll get another one at some point, but overall they just make our lives a little bit healthier. And this is a really good strategy for most people, of course, not if they are afraid of dogs or allergic to dogs, but
Mm-hmm.
for a lot of people, having a pet will get you outdoors and get your body moving.
Yeah, I think that's awesome. I tell this story quite a bit. Like I got into shooting a bow about eight years ago, I guess, and then my friend of mine said, "Hey, you should go do archery. You should do archery hunting." So I was like, "Okay." So you go out into the woods, and when I first started going out, I was like, half an hour, 2 hours. I'm like, I got stuff to do. Like, I'm just anxious. And I was leaving the woods one day, and I was like, why can't I sit with myself for that long? I'm like, if I can't sit with my own thoughts that long without trying to go do something else, right? Maybe I need to spend more time with myself, by myself, and start kind of clearing those things out, right? We do because when we have a lot of stuff going on in the mind, we often go watch TV or we have a glass of alcohol or we look at social media and get distracted from it and get focused on something else. But I recommend to a lot of clients, not everybody needs to go hunt, but go sit in the woods for by yourself for a while, and you're gonna figure a lot of stuff out. And if you struggle to sit and you're antsy and edgy, that means you need to sit there longer and try and start to figure that out. But to me, I just had this conversation with a younger guy last night, and I said, what got you into it? because we're going to be at the same property. And he's like, because I had just started, but he said, honestly, I just needed something to chill out. And so this gave me a chance to sit by myself and yet connect with nature and do something. I was like, it's not just me, but that goes to that story. However you need to do it to get outside and give yourself a reason to be outside, a dog, do more physical activity outside, just go for a walk. If you're into nature or into hunting, yeah, that there's something to that thing. That's why I really love archery hunting, because it's slow. It's not bing bang, it's over. It's like hours that you're out there by yourself, and you figure a lot of stuff out when you actually listen to what's going on between the 6 inches of your ears.
Wow. Yeah, nature can be the best healer, huh?
It can be. So it's more powerful than we give it credit, and many times people would reach for the bottle before they reach for just the door handle and go outside. So Izabella, I appreciate you coming on the podcast for the first time. Maybe we'll get you back on when the book comes back out. Let everybody know where they can find your information, your content.
Thank you so much for having me. It's been such a pleasure. People can find me almost everywhere under Thyroid Pharmacist. So that's going to be my website and my Facebook handle, or they could look at Thyroid Pharmacist Dr. Izabella Wentz. I'm also on TikTok, Instagram under Izabella Wentz PharmD, and YouTube. Thyroid Pharmacist Healing Conversations is where you want to find my podcast. And books are on Amazon and wherever fine books are sold, and Barnes and Noble. So you'll be able to find them there.
Awesome. Well, I appreciate you being on, and I look forward to having another conversation with you in the future.
Thank you so much for having me, and thank you for all the work you do.